wanted to reach out today and talk to you about something that is really important to me and really important to me as a scientist, and that is that COVID-19 is real. I've heard some talk about folks not thinking it's real. We're about to hit a likely second wave, and I want everyone to be protected, especially all my students. And so I want to talk about some testimonials from folks who I know, and many of you also know these people, and that they have been individually touched by a lot of the things that have happened with COVID-19, whether it is folks around them passing or folks around them getting sick. So let's start. I've got a former colleague. She's a guidance counselor, Molly. She says that her father-in-law died in a nursing home 3 weeks ago, and her father is currently at the Veterans Home in Sandusky, where the number of cases is growing. And I pulled this data from a few days ago, but you see that the data in the bottom right-hand corner there speaks to a lot of COVID-related deaths, and that number is just growing. And she also says that a senior she works with says that 50% of the patients at his nursing home have died. My friend Steve, he said that his friend Tim lost both of his parents to COVID a month apart, and that his community felt this one really strongly because that his son had just had their first child in early March. So they only got to see their grandbaby for a few days, a few weeks. So on April 1st, Chris became ill with COVID-19. He fought valiantly, but unfortunately passed away on April 11th. And Eileen contracted COVID-19 shortly after and passed away on May 2nd. I also have friend Holly. One of her friends died January 5th. Her family believes that she died as a result of COVID-19. That would have been really early in our outbreak, but it's completely possible. She became sick Thursday, and by Friday she was in a coma and passed on Sunday. She also has a friend, Katie, who's a travel nurse, came to New York City to help with the outbreak, spent over a week in the hospital and is recovering. And she will live, may have side effects for years, and that's another piece of this that we don't know yet, is what the side effects will be, what the long-term outcome is for a lot of folks who have had COVID-19. She also says that her friend Vinny died, same symptoms as Rebecca, and she had found a friend to bring him fluids, but he died 2 days later. Ms. Brodsky, most of you know Ms. Brodsky, says that her best friend's mother-in-law died at the end of March. She lived in Beechwood, was 79 and otherwise healthy. She wasn't all that sick, and then was feeling really tired, went to take a nap, never woke up. I have a neighbor down the street, same thing happened. And she was 60. Her son just graduated Shaker Heights High, and she never got to see him. She never got to see him graduate, despite the fact that the ceremonies weren't the same this year. And so Ms. Brodsky says that her 3 children who lived across the country and her husband, who had to be confined to home isolation, they all had to watch her be buried on Zoom. You know Ms. Schwab. She has a friend who works in healthcare with patient advocacy and has a brother who has it for now 9 weeks. And so he was interviewed. You can watch it on YouTube yourself. I have the link in the bottom right-hand corner there. He talks about how difficult it has been for him to recover. Dr. Flowers, you know Dr. Flowers. One of her close friends lost her husband to COVID-19 just the other day, and he was only 56. Finally, I have a former student of mine, Ashley. Her grandfather got COVID-19. He's still in rehab, may need dialysis. He was in a coma for 3 weeks and has had some memory loss because of that coma. He was on and off a respirator. Things, of course, turned out really well. He's obviously up and about, doing strength training, but her words at the end I'd like to read. It is a serious, deadly virus with the potential to wipe out a massive chunk of humanity. Please stay safe until we have the time and tools to fight this properly. And one word about conspiracy theories. I don't want you to fall victim to a lot of the misinformation and disinformation that you see out there. Right now, we are feeling powerless. We're feeling vulnerable for a wide variety of reasons. And one of those reasons is because this virus is invisible. It is indiscriminate, does not choose who to infect. And we feel like we have very little power over whether or not we get infected. And so people who feel powerless or vulnerable are more likely to endorse and spread conspiracy theories. It is a way to easily explain what is happening. It's a way to explain unlikely events. This is something that almost no one alive has experienced. And so it's extremely difficult to explain it with the same tools that we've used to explain other events. It's also a way to cope with a threat. It's a very existential threat. It's a threat to our well-being, our health. And so it's difficult to accept that this big event could have an ordinary cause. It's difficult. So understand that it's difficult, and that's okay. Yeah, fine, read those conspiracy theories, but at the end of the day, understand that you know people who have been personally touched by this, who have lost loved ones. You may yourself have lost a loved one. So please be careful, stay safe, and I'll talk to you later.